Hi, welcome to Case of the Day. And we made it to the sixth week. I didn't think I would last this long. And here we are on our 21st case titled Dermatomyositis and the Myositis Protocol MR. This image actually sums up the entire protocol and case. So, this 55-year-old diagnosed to have dermatomyositis was referred for a myositis protocol MR, and I read the scan this afternoon. And you can see in the right upper limb, there's marked atrophy of the proximal muscle groups, but no edema. The same thing on the left, there's marked atrophy, no edema. The pelvic muscles show edema, but there's profound atrophy of the anterior compartment and the gluteal muscles with marked fat infiltration. The leg muscles do not show edema, but again, the deeper compartment muscles show symmetric atrophy and fat infiltration. So, this is the finding: bilateral symmetric atrophy, fat infiltration of the shoulder, pelvic girdle muscles, etc. And I remembered in 21 we had this paper published. Khushbu did all the work, and we had talked about the different manifestations and the different idiopathic myositis groups. And in dermatomyositis, these are the various findings. Symmetric, you get subacute edema, facial edema, honeycomb pattern, etc. So it varies, it depends upon the phase of the disease when you would see this. But that's the protocol. It's three sequences: stir coronal, T1, and stir axial, right upper limb, left upper limb, pelvis and thighs and legs. The interpretation is quite simple. You look for edema, present, absent, pattern, and mention the muscles involved. Atrophy, same thing: present, absent, pattern, fat infiltration, and the muscles involved. Overall asymmetry, symmetry, upper limb, lower limb, and other findings. There was a very recent paper as well, published I think in early 25. That also lists the various findings, and you can see here that dermatomyositis is, affected with, or rather, can have calcinosis, which we saw in this 44-year-old. This patient had come for MR, myositis protocol, and a CT chest, and um, because I knew the patient had calcinosis, we just did a quick low dose CT, and you can see the extent of calcification in the soft tissues here, but we couldn't really see it on MR. And on the MR, there's mild edema of the shoulder girdle and arm muscles, but hardly any edema in the thigh and leg muscles. But there is mild atrophy, no significant fat infiltration in most of the muscle groups. One of the earlier findings in dermatomyositis is facial edema, which you can see here in this patient who was known to have dermatomyositis. The muscles don't show edema, but you just see facial edema. And this is from the article. I couldn't trace the original study, but you can see this honeycomb pattern of edema in the thigh and leg muscles with atrophy and fat infiltration. So the myositis protocol involves scanning of both upper limbs, pelvis, thighs, and legs in patients with known myositis syndromes. Let's say the study comes to you saying this is a known dermatomyositis, polymyositis, etc. Then we just have to map the disease, the extent of inflammation, atrophy, and the muscle groups involved. But most patients don't have a defined diagnosis when they come for a myositis protocol MR, in which case we look for the pattern of involvement and suggest a possible diagnosis, as well as the most inflamed muscle, which then becomes the muscle to be biopsied to figure out what's going on. That's my WhatsApp channel, and thank you for viewing this. Take care.